And when COVID-19 was first reported, very few people, if any, could fully comprehend the extent to which it would ravage and tear down health systems across the world. Now, the World Health Organization declared it a pandemic as the medical sector began categorizing those who are most at risk, amongst them expectant women. Now, here in Kenya, the health systems were simply not ready for a pandemic, much less to handle pregnant women who presented with COVID-19 symptoms in the midst of this pandemic. Our reporter, Mary Mwoki, brings you some of the guidelines put in place by the government in the management of COVID-19 in pregnancy.
Pregnancy is ideally a special time in the journey of many women, but not so for thousands of women who were expecting during the pandemic. Reduced movements, lockdowns and separations from their loved ones, and the ever-present fear of contracting COVID and how that would affect their health and that of their unborn baby put a damper on what should have been a lovely journey to bring forth life.
Pregnancy is a very unique stage in the woman's health, and in the sense that it presents extra strain to the body, so that how the body functions, it is functioning for two people.
Gertrude Amlaka, a mother of three, is one of the women who bore the brunt of COVID-19 pandemic. She lives in a single room in Nairobi's Kibera slums and happened to be pregnant in 2020 during the height of the pandemic. Gertrude says of all her three pregnancies, her last one was an emotional roller coaster.
Kuna wakati hata nilimiss kwenda clinic mwezi moja hivi kwa maana nilikuwa naogopa. Nikienda huko pengine naweza kutana na watu wenye wa corona inishika, sana nilikuwa nahofia.
Dr. Fred Kairithia, a gynecologist, agrees that indeed COVID-19 negatively affected the health-seeking behaviors of many Kenyans. A worrying trend set in. Pregnant mothers started keeping away from hospitals and only went when it was too late for some.
Lockdown prevented pregnant women from coming to facilities, and some of them were able to arrive very late with complications. So COVID actually interrupted the usual antenatal follow-ups, and that is the point when we pick mothers who are at risk.
Dr. Kairithia says COVID also exposed a lot of shortcomings in the health sector. Medics were working around the clock, literally racing against time to save lives in health institutions that were simply not equipped to deal with a health crisis of epic proportions such as COVID.
How people access emergency care, how they're able to be picked, availability of basic components like oxygen, a few emergency drugs. We came to realize that there was a lot of gaps both in the national managed facilities.
Lockdowns and curfews imposed by governments to curb the spread of the disease spelled doom for a lot of expectant women. The curfew effectively made it difficult for a lot of them to seek medical care if an emergency arose at night.
There are a lot of time labor tends to come at night. So you can imagine, even if you don't have COVID, you are pregnant, you know there is curfew, you don't have a car of your own.
Kusikia labor ilikuwa usiku, saa 5 ya usiku. Ambapo nikaita one of our community health volunteer. Juu nilikuwa nimeogopa hata mwenyewe kutoka nje.
Expectant mothers who beat these seemingly insurmountable odds and made it to hospitals for delivery had another challenge to contend with. They had to endure the sweating and panting with their masks on.
Hapa yenyewe ilikuwa ngumu na hiyo mask kwa mdomo. Lakini hao manases walikuwa strict sana, ambapo wako wanataka hiyo mask utoe kwa mdomo. Sasa ilikuwa tu ni lazima utakuwa nayo.
With these shortcomings, the Ministry of Health put together policies and guidelines on the management of COVID-19 in pregnant women. Pregnant women who presented with moderate illness were admitted to the wards. They underwent fetal surveillance to ascertain that all was well with their unborn baby. Those with severe illness were admitted, underwent fetal surveillance and delivery considered if the attending doctor felt the pregnancy was compromising maternal care. For pregnant women at 28 weeks and below that lacked adequate oxygen saturation, doctors were required to consider delivery to improve her ventilation status, administer corticosteroid use for lung maturity, and magnesium sulfate for neuroprotection. It was also crucial to ensure access to neonatal intensive care unit. There was also increased risk of intrauterine fetal death. For pregnant women at 28 weeks and above who lacked inadequate oxygen saturations, the attending doctor was required to consider delivery to manage maternal ventilation as well as administer corticosteroid use for lung maturity and magnesium sulfate for neuroprotection. The COVID-19 pandemic got health systems unawares, and those in the health sector agree that although the sector was largely unprepared, our system can never be adequately prepared for pandemics. Mary Mwoki, Citizen TV, Nairobi.